5. If you want to come up after the assembly.
Hello, Representative.
How you doing?
My name is Rebecca Schroeder. I was born and raised in Idaho, and I've lived and worked here in Coeur d'Alene for about 12 years. My son attends public school here, and I sincerely love my community and my state, and I want to thank you so much for your willingness to interact with your constituents. I appreciate you being here today as much as I appreciate you taking meetings with me in your office on Capitol Hill. We met most recently regarding healthcare about 6 weeks ago. My 9-year-old son, Brady, was born with cystic fibrosis. Here's Brady. He goes to school here in Coeur d'Alene. And I serve as the National Advocacy Co-Chair for the Cystic Fibrosis Foundation, which has led to our many face-to-face discussions on the impact of healthcare policies on patients with rare diseases like cystic fibrosis. You already know that it's a pre-existing condition he was born with, and you know that a few decades ago, kids with cystic fibrosis weren't expected to live to attend elementary school. Because of the miraculous advancements in the treatment of the disease, my son's life expectancy has been increased by decades, and he lives a very normal life today. But without access to that specialized care and designer medication that he needs, his disease goes right back to being the same death sentence that it was before all of this incredible American innovation. Congressman Labrador, you voted yes on the healthcare legislation yesterday, and you've been quoted in the media calling them shameful, those that are saying this plan threatens people in our society with pre-existing conditions. What you fail to mention is that besides the media, dozens of other organizations that represent healthcare professionals like the American Medical Association, the American Hospital Association, the American Academy of Pediatrics, to name just a few, as well as nonpartisan, patient-centered organizations like the Cystic Fibrosis Foundation, like the American Heart and Lung Associations, and like the American Cancer Society, have all also come out strongly in opposition to this legislation because of the dramatic negative impact that they represent. So, Congressman Labrador, the question that I have for you is that are you asking us to disregard the voice of the patients and the healthcare professionals that provide this care? For us, I trust my child's life with these people, and either they are lying or you are lying about this legislation. High-risk pools represent a systematic discrimination of insurers to people with pre-existing conditions, of which 40% of Idahoans qualify as having one of those conditions. There are decades of data on the historical inadequacies of high-risk pools, which is exactly why these organizations oppose them. Please explain to me. Please, the last time I sat face-to-face with you in your office, I explained to you how my child would have already maxed out his lifetime of insurance benefits without the protections in the Affordable Care Act, and you looked me right in the eye and said, that is the worst piece of legislation ever written, and it must be repealed in its entirety. Your lack of compassion literally haunts my dreams, and I cannot rest knowing that my child's ability to literally breathe rests in the hands of people who are lacking in the moral priorities that I hold. Please explain this to me. Justify what you are saying against what these organizations are saying.
So Rebecca, you and I have been For 7 years, you and I have been meeting. I have always thought that our meetings were very positive until this last time. I read your letter to the editor, and I was surprised, to be honest with you, by what you said in the letter to the editor. Because I thought you and I have always had a good conversation. In fact, I used to look forward to those visits because I thought, had a really great conversation, even though when we disagreed on things. You left that day with a different idea of what I said, because I didn't say the things that you think I said.
That meeting was attended by my husband,
I understand.
another CFO who's your constituent, and another
also my staff, and they disagree with your analysis of what happened that day.
Where are they at?
Where
are they?
Can I please answer the question?
Yeah.
So, you and I disagree on this. And I told you that we wanted to protect people like your son, while at the same time protecting the 93% of Americans who have been harmed by Obamacare. So what I was looking for was a win-win. A win for you and a win for the rest of Americans. That's what I've always wanted. So I am trying to find a solution that reduces the cost of health care for all Americans, not just for a select few. And that's what I want. You and I disagree on the policy. You think Obamacare is that policy. I don't. I just want to find a better way.
That's not what we disagree on. And I have never said that Obamacare is a great policy. In fact, I am desperate. As someone whose child's life depends on healthcare, I am desperate to see improvements. But it would be naive to think that it couldn't get worse than it is now. And this bill does not represent reform. It represents a step backward.
What I want to do, and what we're creating is a system where the health insurance premiums for all Americans go down. There will be a group of people, and I don't know that your son would, I don't think that your son would even fall under this.
I trust the opinion of the Cystic Fibrosis Foundation and the professional medical organizations.
Yeah, and they were also for Obamacare before. So
protected him.
What I want is to make sure that 100% of my constituents receive the benefits that you have received, where you have seen, I think your son's story is amazing. And you have shared it with me so many times.
And without access to health care, his lungs fill up with mucus and he suffocates on his own. He drowns in his own body. I am never going to let that happen. You are minimizing the impact on people with pre-existing conditions. You're absolutely minimizing that. Patients will not go back to discrimination without kicking and screaming. And I will not rest as long as you represent me, and I will be back to see you. Okay. Because I have no choice.
Thank you.